after that, I am just so excited to introduce our featured guest for this evening show. I have the honor of welcoming an extraordinary leader in the world of nursing, someone whose passion, expertise, and innovation have reshaped the landscape of healthcare. With over 3 decades of diverse experience spanning from medical, surgical care, critical care, and emergency medicine, he has not only mastered the art of patient care, but has also led and inspired countless healthcare professionals along the way. He is armed with a master's in Nursing Informatics and a doctorate in nursing practice, with a focus on leadership and innovation. He is a true trailblazer at the intersection of healthcare and technology. As an informatics nurse specialist, his mission has been to bridge the gap between cutting edge technology and clinical excellence, designing workflows that enhance patient safety, optimizing documentation systems, and leading transformative education initiatives. His contributions to nursing informatics have not gone unnoticed, earning him prestigious recognition from professional nursing organizations for his outstanding dedication to advancing the field. He is a certified emergency nurse and an influential educator. He is deeply committed to shaping the next generation of healthcare leaders. With an unwavering drive for innovation and relentless commitment to elevating patient care, he is a force to be reckoned with in the ever evolving world of nursing. So, ladies and gentlemen, please join me in welcoming a visionary in nursing, leadership, and technology, Dr. Ian Kirit. Hi,
Wow.
Ian. How are
Hello.
you?
Wow, I feel so elevated with that introduction. Thank
Yes,
you
you
so much.
better. We're going to have a good time over here. Welcome, as what I've said. It is an honor to have you on this show. I know you're busy, but thank you so much for your time, for being here. We'll be talking about AI and you'll share your insights and inputs.
Absolutely. And again, it's an honor and a privilege to be joined or to be part of this initiative. You, for one, is also a trailblazer for doing this. I told you in our messaging how inspiring you are for having this platform to educate our fellow nurses or even everybody about technology and about nursing. So let's do this. And again, coming from the same part of the Philippines and being an alumni of our alma mater, College of Nursing, Silliman, I can never refuse the offer. So let's do this.
Tell them a little bit about yourself, family life, and also your professional life and your journey into obtaining your PhD degree and what you're currently doing right now.
Yeah, absolutely. So I graduated in 1995 in the Philippines, College of Silliman University College of Nursing. I worked at Silliman University Medical Center at that time. This was 1995 and then 1997 until 2002, I think. And then 2003, I taught at the college, and I taught there for third year level three nursing students. And then I got the opportunity to come here. I was also a politician, by the way, in the Philippines. And in fact, I didn't finish my term because I ended up coming here in the States. That was in 2004. I was hired, a direct hire from one of the hospitals here in New Hampshire. And I was working in the ICU and then did emergency nursing, became a house supervisor. And then I got introduced into information technology at that time. I was involved in implementation of an electronic health record system in the emergency department, and that allowed me an opportunity to travel all over the country doing implementations in different ERs. So I was able to travel across the country for that. And then, during that time, I was enticed to enhancing my education. So I got involved with informatics. It's like, why not join or get my master's degree in nursing informatics, of which I did. So I graduated in 2012. So I've been kind of really immersed into the whole technological integration with nursing during that whole span of time. And then I moved to bigger hospitals. I worked in the ED again at a really level one trauma center. And I was doing like house supervisor, being part of the clinical staff, and at the same time also involved with informatics, with nursing documentation, workflow integration, process enhancements, all of those things. And then in the last, I would say 6-7 years, I was an Informatics Nurse Specialist. That's when I was really fully integrated into the world of information technology. And then I sort of got tired with that whole, the whole pandemic being just some remote work, and then quite, half and half going to the hospital. I kind of missed the clinical side. So last year I switched jobs again and did the ED clinical manager and educator of another hospital's emergency department. But even with that role, my whole knowledge about information technology, nursing informatics, and all the recent advancements, evidence-based practice, all of those things are still kind of integrated into my role. So I guess, my clinical background is fully merged with my whole experience and knowledge with information technology. So it's a good merger, a good marriage, I would say.
That's awesome. And you've really honed and mastered the skills in informatics and also the clinical aspect of it. So that's really great. And it is just very fitting to have you on the show as we talk about artificial intelligence. So what excites you the most about AI in healthcare right now?
I mean, even just the thought of AI, I already get excited. I mean, think about, you already mentioned several of those things, like personalized medicine, predictive analytics, all of those things, like ChatGPT. I mean, back in the day, I'm sure you've experienced like creating a nursing care plan, asking about, give me a patient that came in with shortness of breath and chest pain. And lo and behold, it will give you everything that are evidence-based management, screening, identification, intervention. So you give me the data, like, okay, I'm age, whatever, these are my risk factors, all of those things. Just giving you the data, and then AI will give you like predictions. Oh, you are 50% chance of having a stroke, 20% chance of having an MI. So things like that. Just imagine the technological marvel that would be. So it kind of bridges the gap or closes the gap between like, trying to prevent the occurrence. So you already are armed with all the knowledge for you to kind of change your ways and change your lifestyle. In that way, you won't get to what was predicted. So it's kind of like being forewarned, or being forewarned means you are being armed, right? And same thing with remote. You mentioned about remote monitoring and telemedicine. Right? Just imagine people who live in far-flung areas. They don't get a specialist. It's hard for them to get that. Like, I'm having a stroke, and they don't have to travel like 5 hours to get to a specialized center. With telemedicine, they can easily just press the button, and then a specialist will go look at the patient and then give you advice. Here's what you need to do. Here's the things that needs to be done based on how I'm seeing the patient. And the wearable devices, your Apple Watch, the minute you have like an irregular rhythm, it sends a message to your cardiologist, and your cardiologist will say, hey, give you a call right away and say, you need to go to the closest ED or come to my clinic. So just imagine that. And it's real time. So before you know it, the time that is kind of spent waiting is kind of like very slim now, because you have real time data that is getting to the right provider. So those robotic surgery, you've heard about Moxie, right? The robotic um, um, assistant that is roaming the hospitals in some organizations in some states.
Yeah.
They talk to the patient, like they bring lab specimens to the lab, so that really saves time for the nurses. And you mentioned about medical imaging, instead of like relying on human eye to say, oh, this looks like an aneurysm with this kind of measurement, AI can help you really be more precise and be more accurate. So it's amazing what AI can do, and we are just at the tip of the iceberg. I would say there's just so many more innovations that are coming, and our kids are so lucky, because by then, I mean, you can just imagine, it's beyond me. Yeah.
Right. And then can you imagine in the next decade how it's going to be? You're so right. And yeah, it definitely, at the end of the day, with all this like AI advancement, it's all about like really improving patient outcomes too,
Yeah,
right? Especially here
absolutely.
in healthcare in the United States. It's just, it detects, it can detect this, like near stroke events and even like cancer gene
Yeah.
mutation. So
Mhm.
that is so amazing. And which led me to the next inquiry that I have for you in terms of, how can we, or how do you see AI improving patient care today? Like any specific examples that you already have seen in your hospital or in your other previous, experiences
Yeah.
recently?
Like, I'm sure you've experienced, if you work in the, like, most EMRs now have clinical decision support embedded in the system. So let me take a specific example in the ED. A patient walks in, and a nurse will triage the patient, puts all the data in there. Okay, vital signs, blood pressure, heart rate, respiratory rate. Came in with a chief complaint of, let's just say, altered mental status. I put in my vital signs. I put in all the patient presenting symptoms, and just by doing that, the system, the AI within the EMR will flag you. Oh, all of this, the data that you just added, please, there's a best practice alert. This patient looks like a septic patient. So it gives you a flag, initiate the protocol. So right there and then, as you were talking to the patient, the provider is already seeing that, oh, this patient meets the criteria, let's intervene right away. So it cuts the time from arrival to treatment. So we know for a fact, based on studies, that septic patient that gets recognized right away and given the full sepsis bundle, like fluids, antibiotics, blood, lactates, all of those things, the minute they get treated at the soonest possible time upon arrival, the more likely they're to survive. So clearly, just by inputting all of those data in the EMR, it flags you right away and say, based on evidence, your patient meets the criteria, do this, do that. And that's just for septic patients. Same with MI, same with stroke. It gives you this flag that says right away, instead of you like kind of like figuring things out and kind of having that potential delays of management and treatment, with AI embedded tools within the EMR, it gives you all what they call the clinical decision support that says, okay, implement the bundle, put in this order sets, put in this antibiotics, put in this fluids, and lo and behold, the patient will get the treatment right away.
Yeah.
So it really bridges the gap, and you mentioned it. It brings like immediate care to the patient, and it favors a good positive outcome.
Absolutely,
Yeah.
100%. And as with what you just mentioned in the certain example that you just mentioned, it's also like more of collaborative effort, right? We're still not eradicating the human responsibility because we still have to assess. We still have to put in the vitals. We still have to feed the information
Yes.
into the system, And then our ally, which is AI, would
Mhm.
just help analyze and really cut the time so that that patient, we can save that patient in a timely manner with less complications and allowing for early intervention and better outcomes, which is really
Absolutely.
amazing.
Yeah, and
Really
that's the thing. Like people think that I think it would lead us to our next topic. People think that AI will replace everybody. That they always think, oh my God, I won't have a job anymore because all of this automation, like all the clerical tasks are done by AI. But no, AI is supposed to assist, not replace. It's just one of the tools. And as you mentioned, it is only as good as the data that you feed it into. Like all the algorithms that are the AI tools are based on depends on the amount of data set that's available. So clearly, who's putting in the data? It's us humans. So in fact, you mentioned too about biases, because if you look at the data, we have to make sure that it's kind of really diverse. It's not just based on a specific demographic, like it's purely Caucasians. So if your data is mostly just centered on a specific demographic, then AI would only look into that, and then whatever it suggests would only be fitting for that demographic. What if I'm a Filipino came in and that data, the algorithm is based off a different demographic, so the AI would give you wrong suggestions.
right,
So
right.
that's why it still has to have human intervention. It's just a tool. It gives you the idea, but still your own critical thinking should still come into play. Don't rely heavily on just AI. And I think that's part of the ethics too. Ethics part of the AI.
Yes,
Yeah.
absolutely. Because at the end of the day, the human brain is still the best.
Yeah. And there are
And
still misdiagnoses brought up by AIs. It's not foolproof. It's not like, oh, this is suggested by AI. This is the only solution. Absolutely not. It can only help give you those potential outcomes, but the main decision making should still be you, the one using the tool. So it should be the person using the tool as driving it, as opposed to the tool driving the person. Yeah.
absolutely. Now, another important question that I wanted to ask that I feel so excited to learn is about what are any specific AI technology or technologies that you think will be standard in healthcare in the next coming years?
Well, you mentioned about the NLP, the natural language processing. You talk about machine learning, deep learning, all of those things, right? If you look, even if you just do chat GPT and you say, what are the different technologies of AI? It gives you different layers of AI. One is one that is just based on existing data. And there's a second layer, even third layer, that kind of like thinks like a human brain. Like it makes you like it kind of process not just present information, but also past information. So it's like it's really like a human brain now. It's functioning like it's just not feeding through the data, but it also have some sort of memory to kind of really come up with a much more robust suggestions or whatever you're looking for. It's really getting to that close of the answers that you're looking for. But I think the most interesting part is like about documentation burden, right? Like
Yes.
nursing providers, AI chatbots are gonna be like in the mainstream. Like, have you experienced going to your provider and the provider is mainly just talking to you now? Like
Yes.
hardly looking at the computer or typing, and then
Yeah.
all the providers just saying like, "Oh, I have this system that is basically doing the documentation for me." So now providers or even nurses have more time talking to the patient instead of, okay, what was your complaint again? Okay, let me type that in. So what was that? So how long have you been having it? Okay. No, there's much more casual, much more humane conversation happening because technically the chatbots are doing the documentation for you, and all you have to do now is just review it. And have you experienced like WebEx meetings? forget about taking minutes. After the meeting,
It
in less than
summarizes for
five
you.
minutes, they will send you an email, a full recording, and notes of everything that's discussed in the meeting. And I have to say, oh my God, it does way better than me taking the minutes because it really
Yes.
captures everything and it arranged the main concepts, supporting documentation, everything. So those things and robotics too. Like I mentioned a little bit about robots doing surgeries, the less invasive surgeries like prostatectomies or cardiac valve repairs, those kind of like simple procedures. I mean, just imagine robots doing the surgery. It's much more precise. And I mean, this is where things are going to go. It's just so many, and again, natural language processing, machine learning, those are all happening now, like predictive analytics. You can see that mainly like embedded within like radiology, all different EMRs, like Epic. I mean, Epic in and of itself. I mean, I maybe I don't have to mention brands, but any kind of EMRs mostly have AI tools embedded on it now. Yeah. So
Absolutely.
really, really, and even Google, like Bing, like all of this, they are all AI tools on it now. Yahoo, all those search engines have AI tools embedded on it. So it's much more comprehensive results when you do it, when you do the search.
And it's so amazing too. I'm just excited about utilizing this like technology that will be standard in AI in the near future because it definitely relieves the burden, the administrative burden
Yeah.
for supervisors and managers and helps them focus more on the tasks that really matters and most importantly also bedside nurses. As you
Yeah.
know, bedside nurses are mostly burnout, especially after the pandemic, and relieving documentation burden out of their hands and integrating artificial intelligence through that will definitely allow them to at least take a 30-minute break to recharge if they work 8 or 12-hour shift.
I
So
could not agree more. Yeah. When I
I'm
was doing emergency nursing in a level one, I almost always end up staying after my shift because I have to review my documentation and make sure that I captured everything that happened during my shift. Because if you're so busy, you don't have time to go back and or do documentation real time. And that's I'm sure that's a pervading challenge in most organizations. And AI is really promising to address that. The cognitive load, the documentation burden, it
yeah,
clearly reduces nurse efficiency and takes away patient time. That's the most important thing. Yeah.
it truly does. And one thing that I have that I actually thought about is and I'm pretty sure if you're a bedside nurse or if you are more on the administrative nurse manager supervisors, one thing that we can all agree on is scheduling. I know there are already like systems out there that is very robust in terms of capturing everything so that on the administrative part they don't need to be doing everything manually in terms of bed management and what are the potential risks in terms of like staffing. And so as for bedside nurses, if you integrate scheduling or AI in the scheduling system, then it definitely automates everything for you, thereby reducing a lot of errors and giving you more time to be less stressed about nurse scheduling. Do you agree on that one?
Absolutely. Absolutely. And I mean, just imagine when you used to do manual scheduling, right? There would be a lot of errors and people are not happy because like they're not getting the right schedule. They're not getting, you know, because it's not easy to kind of look ahead or look back. But now it's so easy. Everybody can just go put in their schedule, and for some magical reasons, AI will just arrange everything and then makes everybody happy. But again, it takes for us to still review it, but it takes away the burden of the heavy task of kind of like, I mean, just imagine simple idea. You go into your house and everything is so cluttered. Instead of you doing all the work like this needs to go here, this needs to go there, if you can just press a button and then AI will take care of everything, he would just be watching TV for the most part because all of those heavy tasks are done. And same thing when you're in a hospital system, integrating AI into your workflow to make it much more efficient and effective is really the goal. And if AI takes care of all those manual labor that we used to do prior to I mean, who wouldn't want to take that? Clearly, anything that's automated like Alexa, Siri, I mean, those are automation, right? When you
Right.
walk in, you just say, Siri, turn off the lights, automated. Like Siri, like if only Siri can prepare your meals for you, maybe in the near future that will happen with
I would
robots in
like
the house.
I would love that and have like an AI or somebody in the house to do food shopping and run
Yeah,
errands for you. That'd be great. That
right.
would
Or
be
Siri, I
awesome.
mean, it's happening now. Alexa can suggest to you like, oh, you used to buy these things. It looks like you might be interested on this one. So there you go.
Yeah, and then also like I know we already touched on about the misconceptions about AI that it will replace human jobs and healthcare professionals, but it really isn't, right?
Right.
It doesn't. I know there are like some. What can other like misconceptions that you can think of in terms of like integrating AI in medicine aside from replacing our jobs?
And I mentioned it like AI is like foolproof, like it's precise, that it's accurate. No, it's not. There has to be there's still some room for errors. It can still have errors in predictions, or or due to some technical glitches, right? I mean, it can still give you those errors. And also, AI will not solve all of the healthcare problems that we have, like inequalities, understaffing. AI can never solve that. AI can never say, hey, get me a nurse to cover for night shift. AI will not do that. Or AI can never say, why are like, certain demographics are getting this like minimal care. AI cannot do that. So clearly there are limitations. Like the main thing is it's not going to replace our jobs. It's not like 100% accurate, and it can never solve every healthcare problems there is. Because once you think of like AI, it's like, oh, it's so glorified that it's like the best next gift since, sliced bread or whatever. But no, it's not. It's still an evolving technology, but I have to say it's really good at where it is now.
Yeah, I never thought like I was born in the 80s, and at that time we're still so used doing some manual things aside from
Right.
the emergence of computers. But I can't believe right now that we're actually in this generation wherein in just split of a second it's gonna give recommendations and do almost
Yeah.
everything and record everything for you, which is really amazing.
Yeah. And I think, two takeaways: automation and efficiency, basically, is what's the biggest advantage of this AI. And we can feel it now. We can really, really see it now. And but again, there are also some bad things to AI, not just good things. We just need to make sure that we are using it for the right reasons and
Yes.
not like use it for things that can, I mean, I guess with everything there's always the other side. And now that's where human nature comes in, that we need to be responsible in using it. We need to be regulated in using it. There has to be some standards in using AI, because otherwise everybody can just willy-nilly do what they want with it. And for sure, I mean, you can just imagine the immense power it can do if used for the wrong reasons.
Exactly. And thank you, Emerson. We have our producer over here that's saying he's actually listening. Thanks, Emerson. He's listening and agreeing to what Dr. Kirit is saying about automation is key and also efficiency, which is very, very important. It really helps in terms of utilizing AI.
Yeah.
Now, just to wrap up this, these questions that I have in mind, because you're the best person to answer this, having a background in informatics, is what do you think should everybody or the healthcare professionals or healthcare organization should be doing to prepare for gazillion AI integration in patient care?
I think the best thing for us to do is to be AI literate. Like, we all need to know what AI is all about, what it's capable of, and also how we can use it effectively for our job. Like, if we say AI, we need to have like a really good grasp of what it's about and a clear understanding. And the way to, there's a lot of AI like free webinars on how it's integrated into healthcare, how it fits into the nursing workflow, the provider workflow, how it helps with project management, how it helps with process improvement, all of those things. And I think, like, even when we use chat GPT, we need to learn how to do the prompts. Like, when you type in prompts, okay, give me the most recent emerging technologies of AI, it give you all of those things. And after that, follow it up with, out of those emerging technologies, which one do you think is most beneficial to nurses? And then it gives you all of those, like, it slims it down. And once it slims it down, again, you will ask it. So really, you're gearing it from being so general into how it can really fit into what you're looking for. So, and there are a lot of prompts that, and there's even a cheat sheet of prompts that you can do for AI to really give you the right kind of information that you're looking for. And the other thing too is that there needs to be transparency. Like, all those algorithms, there has to be a way for us to know, like, okay, what are the algorithms? Is it based on what kind of demographics? In that way, we can avoid the biases with AI. And same thing with, not just for us to learn about AI, but also for the patients. Like, if we are using AI tools, we need to let the patient know. You mentioned about data privacy and security. We
Right.
need to make sure that we need to inform the patient, like, by the way, we are collecting your data. We have AI tools that are embedded within our AMR, and we are using it. Just like when I went to my provider, he told me about the system that they were using, that were listening to our conversation. Because that can be like, if you're not informing the patient, you might be, you know, you might be viewed as like having HIPAA violation, because you're kind of like recording something without the patient's consent. So there needs to be some kind of transparency and patient education. And also, standardization of data is also very important. We need to have like some form of data set that is standardized. And we know for a fact that different healthcare organizations sometimes use different kind of EMRs. And
Mm-hmm.
it's hard for patient, like, if I here in my state and then I go to a different state and I end up visiting a healthcare provider there, they have probably have the difficult time accessing my information. So we need to work more on interoperability, so that regardless of where I'm going and regardless of who I'm seeing, every provider have really readily accessible information, patient information, that they can look and provide the right care for that patient, because
I
there's
love that.
always that challenge. Yeah.
I love that. I wish as we gear towards AI in the future, we can certainly do that because that's quite a challenge. You know, when you go to different clinicians and they have different systems, electronic medical records, and not all of them are basically what everybody's using. And it's just so
Yeah,
hard.
it is
So I
hard.
hope, yeah, I just hope because communication is key and making
Yeah,
sure that you have accurate health history and all your data, and everybody can just, all your healthcare providers can just
right.
see it.
I mean, just imagine, I used to, when I first got here, this is back in the day, I was still using paper charting. And when a patient comes in, I have to go downstairs, go to the medical records, look through the file, and like, okay, it's all labeled A to Z.
Oh
Find
gosh.
that patient, bring this huge stack of documents, bring it upstairs, and then the provider will scan. What's our old EKGs? What's our, like, I mean, the amount of time that's spent doing that, as opposed to like pressing a button, it gives you all the medical records. You can easily compare new EKGs, old EKG, so you can see the difference. So that in itself is a huge win. And also, let's just say a patient visiting a different state, something happened, went to a hospital, unable to say something, like unconscious. How will the provider know if he or she doesn't have ready access to the patient information? So interoperability of EHRs is a huge help, not just for the provider side, but also for patient care.
Right.
Yeah.
Maybe we can invent a wearable device that has all their H and P in it.
Yeah, and again,
That's a thought.
it's really AI integration involves a lot of disciplines. I mean, I know that, I mean, not just in healthcare, but in finance, right? AI can be really helpful. Different disciplines, different professionals, I don't know, lawyers, engineers, we all need to collaborate and make AI, this whole integration of AI tools into all the different fields that we work. I think that's where the future should go. But then again, the government or regulatory standards should have a clear grasp and hold of everybody. In that way, everybody's not just willy-nilly doing their thing, and then it's beyond the control, and then we end up like having much more risk than benefits.
Right. Yeah. Especially in terms of data breach and arming privacy, which is very important.
Yeah.
Oh my, it's almost 7, but we do have some time because we have a lot of people watching us, and really they've learned a lot from all your insights, Ian. So we have a few questions over here from our audience. So from Harleen, she says, is there a possibility that AI would evolve and become self-aware?
Funny that you asked that, Harleen, because as I mentioned earlier, there are different levels or layers of AI. Like, I think we're just scratching the surface. Even if you Google it, there's like the second layer that's able to think. And then I think it's the third one that has that self-awareness. So we are getting there. I mean, to me, the thought of that is kind of scary, but I don't know. But I think maybe with the tools that we have now, I'm not fully familiar with the self-awareness aspect of AI. Like, it's like, does that mean it can think for you? Like, you would just say AI tools like, AI, can you tell me how I'm feeling right now? I mean, I don't know how that really works, but I know that that's coming. The self-awareness part of AI. That's
Wow.
scary. Like, when you walk in and then Siri will just tell you, "Oh, you look sad. Oh, you seem happy today."
Right? Yeah.
Yeah, like, can I offer you anything? Like, oh my God, that's like, just imagine. Maybe, and for sure that's coming. That's in the horizons. That's for sure. Good question.
It
But
is. I
yeah,
know we have a
that's
lot of people
evolving.
here that's listening to us and really putting in a lot of like valuable questions over here. Entrepreneur says hello. We have another question here, but it's all gonna boil down into our last takeaways about AI. And Entrepreneur says advice in using artificial intelligence. A few words from that.
To me, I think depending on what field you're working, like, it can be used in the academe. It can be, but again, don't let it write your own thesis paper, or don't let it do your homework, because there's a way for our academic people to know that. So don't do that. But just little things, like if you are trying to do a process improvement project, like, or present a problem, and then just put it in chat. First thing you have to do is like learn how to use Chat GPT. Anything there. Just type it in, and then whatever you're looking for, and then it gives you a lot of good ideas. Instead of Googling it, just do it in Chat GPT, and it will give you a lot of information. And as I mentioned earlier, drill it down. It gives you the answer. Ask another questions on top of the answer that was given to you, to really focus it on what you're looking for. And LinkedIn has a lot of, I think there's a guy there, is like AI guru, that gives you a lot of infographics about the prompts. Those are very helpful. If you're looking for this, This is the prompt. This one. So try to maybe I can send Antoinette the link and then she can share it with everybody. But I think I even have that infographic. But and there's a lot of webinars there that are free too. So it's limitless what you can do with AI. But basically just knowing how to ask the right prompt to get your answers. Yeah.
Right. And don't be scared to utilize AI.
Yeah,
As
don't be. It's right there. I mean, it's free. You can use it. And even like the way you communicate, if you're struggling with how to phrase something, I want to send a message or send an email, just type it in and say, please draft an email to a friend that I haven't seen for years. Just try that and you would be amazed at what AI can do. And you would be so like, and once your friend receives that message, you'll be surprised. Your friend will call you right away because it was a very beautifully crafted mail or letter.
That's
Try
awesome.
that.
There
Right
you go.
after we do this, go to Chat GPT and play with it. You'll be spending it the rest of the night or day because it's so fun to do and to use.
Awesome. There you go. Those are very important advice from Ian, Dr. Ian
But
Kirit.
again, I'm no expert, but just based on what I've learned, I'm just sharing it with you guys. And again, continuous learning, have that growth mindset. Learn a lot more about AI and it will change your life. But use it for
Exactly.
the right reasons.
And yeah, definitely we're not experts, but this is based on experience, based on work experience and different organizations that we've worked before, and also being nurses, right? Working in the nursing field, because we're talking about AI in healthcare for this evening's topic. And Nancy, who is also a member of the Philippine Nurses Association, says great information. So
Oh, I
thank
know,
you,
Nancy.
Nancy. Yes, we have a lot of, and just to mention, Philippine Nurses Association of America and Philippine Nurses Association of New England, they are one of our supporters in this evening's episode because they know that Ian's actually going to be our special guest. So thank you very much. And for any of you who would want to join Philippine Nurses Association of New England or Philippine Nurses Association of America, if you're from another state, you can always visit their website and be a member. We have a lot of great things going on and volunteer outreach programs that the Philippine or the PNA is offering. It's 6:57 and I wish we can still continue this conversation, Ian, because there's just so many great information to talk about. That we're fired up once, we talk about healthcare, nursing, because we are nurses and we have a lot of stories to tell. But I just really wanted to say thank you for being here. And also, if you have any other last shout outs to anybody, I don't know if you have any other shout outs to your family or anybody or to Silliman University, please. I'll give you the airtime right now to say whatever you want to say before we end the show.
Yeah, well, first, thank you for this opportunity and thank you to all our listeners. Thank you for being engaged and please reach out if you have anything that's bugging you. We are more than happy to address your questions the best way we can based on our knowledge. And again, we're no experts, but we can offer just share our thoughts. And of course, thank you to you, Antoinette, and to Emerson for this. I totally appreciate being a guest speaker for tonight. And thank you. Of course, shout out to Pinani. Again, if you want to be a member, please, we are seeking membership. It's a great organization to belong to. Shout out to Silliman University College of Nursing. Both me and Antoinette are alumni. Great school. We owe it to our alma mater. And of course, to my family, my wife, who's taking care of the kids now so I can do this. Thank you, Karen, for being such a great wife and giving me this opportunity and time. And of course, I think we should always thank God for our life, our career, our contributions, and may we always do what we can to better the nursing profession. And let's continue to elevate our voice. And thank you for this platform because the more we are, with a collective voice, the more we are together, then the stronger our voices are, and we can really make a change, even if just little steps, but together we can really move forward. So let's do it for us, let's do it for nursing, and let's do it for our family as well and our loved ones. So thank you, Antoinette, thank you, Emerson, and thank you, everybody. All
Have a good
right.
evening, everyone.
Bye bye.